Hello, and welcome to drvoices.com, where doctors come to teach and where patients come to learn. Today I'm very fortunate to have my dear friend and colleague, Dr. Meeta Sharma, here with us. Today she's going to give us some tips for a healthy pregnancy. Dr. Sharma graduated from Dartmouth College, and then she went on to earn her medical degree from the Penn State College of Medicine, where we were classmates. Currently, she's a chief resident in obstetrics and gynecology at Thomas Jefferson University Hospital, and she's going to be in practice in a few short months. Now, the first question I have for you, Dr. Sharma, is what recommendations do you have, what advice do you have regarding prenatal nutrition?
Nutrition is a very important topic for pregnant patients because it's hard to know how much and what you should be eating. The American Congress of Obstetricians and Gynecologists recommends a website called choosemyplate.gov. Now, this website helps patients determine how much of each food group they should be eating during each trimester. The other important thing to remember is to continue your prenatal vitamin, which should have folic acid in it. The reason this is important is you want to make sure you're getting the appropriate vitamins and minerals necessary during your pregnancy. Caffeine is also a big question that we're asked at office visits. How much is a safe amount? Now, most experts say that about 200 milligrams of caffeine a day is a safe amount, which is about a 1 12-ounce cup of coffee.
Gotcha. Okay.
Patients often ask about, can they eat fish? The reason that this is an important topic is because fish has mercury in it, and certain fish have more mercury, and mercury has been linked to birth defects. So the fish that you want to avoid include shark, swordfish, tilefish, king mackerel. It's safe to have things like salmon or tuna. Tuna, though, you want to limit to about 6 ounces per week.
Okay.
There's another infection called listeriosis. It's a bacterial infection that's foodborne. To try to avoid this, you want to avoid things like unpasteurized milk, hot dogs, cold cuts, undercooked or raw meat. And this is about 13 times more likely to occur in a pregnant patient than a non-pregnant patient, which is why it's important to avoid such things. Now, the last thing to keep in mind is how much weight should you gain in your pregnancy. This is all based on what your pregnancy, what your pre-pregnancy weight was. So if your BMI is normal prior to your pregnancy, you can gain about 25 to 35 pounds during the entire course of the pregnancy. If your BMI is less than that and you're underweight, you want to try to gain a little bit more weight than that. And if you're overweight or obese before your pregnancy, you want to gain less weight than that.
Okay. Now my next question is, what are some of the red flags that patients need to watch out for that should alert them to either call their doctors or maybe even go to the emergency room?
One of the main red flags that patients should know about is vaginal bleeding. It can be not a big deal at all, or it can be an emergency, which is why it's important for patients to touch base with their doctor if they're experiencing this. When it occurs during the first trimester, it could be related to a miscarriage or to an ectopic pregnancy, which is when the pregnancy is not located in the uterus but located outside of the uterus instead. During the third trimester, when it occurs, it can be because of the placenta. The placenta might be separating from the uterus itself before or during labor, or the placenta might be covering a part of the cervix, causing the bleeding to occur. Bleeding is also seen when patients are in labor, and so in order to help to differentiate why patients are bleeding, the doctor is able to help with that. Other things to call your doctor for are if you're experiencing leaking fluid, like you think your water broke, if you're not feeling the baby moving as much as you usually do, if you're full term, if you're feeling contractions, painful contractions every 4 to 5 minutes for over an hour, or if you're preterm and feeling about 4 to 5 contractions every hour for more than 1 hour, it's really important to touch base because these might be signs that you're going into labor.
Gotcha. Okay. Now, then my next question is something that I think a lot of patients are very curious about also, which is it safe to travel during pregnancy?
The best time to travel during your pregnancy is between 14 to 28 weeks, which is the middle of your pregnancy. And this is because most emergencies in pregnancies occur during the first or the third trimester. In terms of flying, most domestic airlines restrict travel during the last month of the pregnancy or require a medical certificate. In terms of international flights, they often have an even earlier cutoff, so it's best to touch base with the airline before you fly to make sure that you'll be able to fly during that period of time. Recommendations for when you are flying: try to get an aisle seat so you can stretch your legs, walk a little bit more than you usually would to help prevent clots in your legs or your lungs. The next thing to keep in mind is you should try to keep your seatbelt on at all times. Keep it below your belly, low over your hip bones. And you want to try to avoid traveling to areas where there's a risk of malaria.
So my next question is actually about a condition that I actually see a lot in my own specialty, which is back pain. And I know that back pain is actually something that's extremely common during pregnancy, so I was wondering if you could share some insights regarding that.
Sure. You're completely right. There are many different reasons why back pain is more common during pregnancy. These include the hormonal changes that are occurring, strain to your back muscles, as well as weak abdominal muscles. There are different ways to help prevent that back pain from occurring. One being getting shoes that have good arch support. A second being trying not to bend from your back, but instead squatting or bending from your knees. And the last suggestion is to try to get a firm mattress to help prevent some of the pain from occurring.
Gotcha.
While you're having back pain, a few different things you can try to do. You can ease that pain by regularly exercising. You can try heat or cold to the back itself, or you can try to take Tylenol, which is safe to take during pregnancy.
Excellent. Lastly, I was wondering if you could talk a little bit about a very important issue after pregnancy, which is postpartum depression, and shed some insight on that.
During the first few days postpartum, patients often feel anxious, sad, they might start crying for no reason. We call this postpartum blues. It usually resolves on its own within 1 to 2 weeks after the delivery without any treatment. When these symptoms continue, when patients are having intense feelings of sadness, grief, anxiety that are interfering with their normal activities, we get more concerned for postpartum depression. Postpartum depression can present anywhere up to a year after the delivery. There are many changes that are going on that might be related to patients getting postpartum depression. Patients who are at higher risk are if they've had a history of depression, if they are particularly fatigued, don't necessarily have a strong social support at home, if they have a difficulty managing stress. If you are concerned that you have postpartum depression, it's very important to go speak with your doctor. There are treatments, including medications, treatment, and therapy that can help you through this period of time.
Thank you so much for that, Dr. Sharma. That was fantastic. I also want to thank all of you for watching. When you get a chance, please subscribe to our channel and also visit our website at drvoices.com. It's all written by healthcare professionals and experts, and it's presented in an easy-to-understand way. It's medicine made simple. Thank you so much again. Until next time.